Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today's video is only relevant if you are on Original Medicare and still have a Medicare supplement C or F. Those are the two plans that, as of 2020, there can be no new Medicare enrollees going on to those plans. If you were on Part A prior to January of 2020, you could buy them, but that probably doesn't make good financial sense because generally, once a new insurance product is closed to new enrollment, and new enrollment includes relatively healthy people, the plan that is closed to new enrollment can get out of whack. Anyway, Plan F was the richest plan until recently, and then Plan G became the richest plan. Plan C, I think the only difference between Plan C and Plan F was C didn't cover the excess charges for those doctors who do not accept Medicare assignment. Anyway, the premiums can vary, and so you've got to do your homework. And of course, we've reminded people that often you cannot change your supplement after the 6 months beyond your Part B effective date without being subject to medical underwriting, which is a health questionnaire. And if the insurer doesn't like your answers, they can reject you. But many carriers are letting people go from an F to a G, staying with their existing insurer. So you do need to run the numbers. Let's just use Connecticut as an example because it's easy. We're a small state, and on the insurance department website, you have that beautiful chart of all the companies allowed to sell these things and all the plans. And so you have to run the numbers yourself. So let's take Anthem because it's at the top of the list alphabetically. The relevant math would be, okay, take a Plan G premium of $228.85, $228.85 times 12 is $2,746.20. Plan G doesn't cover the Part B deductible, which is $226, so you have to add that in, and you get $2,972.20. Now, if you compare that with an F, the premium is $298.39. $298.39 times 12 is $3,580.68. So you're comparing just under $3,000 in terms of out-of-pocket exposure and $3,580. And people react differently to that. Some say, oh, to disrupt my coverage, to save $500-$600, oh, not worth it to me. But the issue could get worse. But I think if you're on CRF, you should look at this. If you look at Connecticut, look at another carrier, Connecticut. Their F and G rates are not that dissimilar. The G is $247.71, and the F is $260. I mean, that is so close. I don't think you'd bother, but you might, because you might be concerned about what the future may bring. Then again, if you look at United, they're a major carrier in this space. The G premium is $231 and the F is $309. So you can see that's getting farther apart. So I think people should look at this and understand, it hasn't been a great system. The federal government standardized supplements in 1992 and came up with all these letters A through J. It's not a great system. It's confusing that it uses letters when Medicare was already letters. Granted, Part C of Medicare Advantage plans and Part D didn't exist yet, but A and B did, so why come along with supplements A and B? There are just too many choices. But as we say to our clients, for the 47 states that use this system, you generally do want to look at G, high deductible G, and N. But if you still have F or C, run the math and make your own judgment as to whether or not you want to call your insurer and see if you can downgrade from a C or F to a G. The only real difference between an F and a G is the Part B deductible. It's $226 this year. Part B's been around since 1966. So there is enormous pressure to keep that deductible low. But the one inconvenience of going from F to G is at the beginning of the year, you would need to meet that Part B deductible. And so you'd have some bills in the beginning of the year for services at the beginning of the year, because you've got to meet that deductible before your supplement starts paying after Medicare pays. Okay, I think we've beaten this one to death. So let's call it a day, and thank you for listening.